Hello and welcome to the Explorer program, webinar number 1. Thank you for being here with us today. I just want to provide some housekeeping before we get started. For the webinar is being recorded, and the recording will be made available to all of you in attendance today. And we are asking that for any questions that you have throughout the presentations today, that you save them till the end, and you could drop them into the Q&A box that's located at the bottom of your Zoom screen. And with that, I will go ahead and hand it over to Dr. Laura Brown from CDC.
Hey. First of all, thank you guys for your interest in NERS and for joining us today. I am going to just sort of provide some context and background on sort of what NERS is all about and share a little bit of information about the data we collect and, do a little promotion on why we think NERS is so valuable. And then we'll turn it over to a couple of health departments that actually use NERS. I think that's probably one of the more valuable things for you guys to hear is how other health departments use it. So I'm just going to just kick it right off. Again, as I said, I'm starting with some background. So when we're thinking about outbreak investigation in particular, and here we're thinking about foodborne illness outbreak investigation, ideally, outbreaks are investigated by sort of all three major groups of the disease triad. So epidemiology really focuses on collecting data from the infected people, from the host. The laboratory collects data on the agent. What is the pathogen that's causing the illness? And then environmental health collects data on the environment. How was it that the agent, the pathogen, was able to get to the host? So I sit in the National Center for Environmental Health in the Division for Environmental Health, Science and Practice, and we're really focused on the environmental component and supporting environmental health professionals. We know outbreak investigation varies a lot from health department to health department, but ideally, all three of these components would be involved in foodborne outbreak investigations. And we also know that a good bit of the outbreaks that are reported to CDC that are investigated by state and local health departments are caused by restaurants or located in restaurants. So 61% of the outbreaks reported to CDC are associated with restaurants, and then another 14% is associated with catering. So we know a lot of outbreaks, a lot of foodborne outbreaks that happen are associated with restaurants. And we know that environmental professionals that sit in food programs and health departments have responsibility for food safety in those settings. And again, I know there's a lot of variability, but ideally, when environmental professionals go out to investigate outbreaks, they would engage in a variety of activities. They might interview kitchen managers and food workers to understand the policies and practices, to understand if anyone has been ill, to understand how food is prepared. They might observe how food is being prepared and do things like take temperatures. They might review or collect records, so they could look at food cooking temperatures or cooling temperatures or trace back records. And they might also sample for pathogens in the restaurant kitchen. And taken all together, we at CDC call all of these activities an environmental assessment. We think when environmental health professionals are able and have the resources to go out during an outbreak investigation, conduct these environmental health activities, they can learn a lot about how the outbreak happened, why the outbreak happened, and then therefore how to stop that current outbreak and learn to prevent other outbreaks. One of the things that we hope these environmental assessments can help state and local health departments identify are the contributing factors to the outbreaks. So how did that outbreak occur? And CDC and FDA have analyzed about 30 years of data, might be 40 years at this point, on the contributing factors to outbreaks, and they've grouped them into 3 categories. So there's contamination, what happened that led to the food getting contaminated with pathogens, proliferation, something happened that allowed a pathogen to proliferate, and then survival. So something happened to allow pathogens to survive on food. So quick examples of this, we have an example of someone vomiting. That can certainly contaminate an environment with pathogens. If food gets contaminated, that might be how the outbreak occurs. Proliferation, a good example of this might be improper holding, improper cold holding, or improper hot holding that leads to any pathogens on the food being able to grow and multiply. And then survival might be inadequate cooking of raw chicken, for example. So you don't get the temperature hot enough to really kill the pathogen and it survives. So this is really useful information to know about outbreaks in general, like what is happening in restaurants that leads to these outbreaks. That's one thing we think environmental assessments can help us identify. Now, there is a outbreak reporting system that state and local health departments use to report data to CDC. And there is a section there where you can report contributing factors on outbreaks. That's the only kind of environmental health data that you can report in that system that's called NORS. And we found over the years that about 50% of the outbreaks reported to CDC have an identified contributing factor. Now that's not bad. And we imagine that you aren't going to get to 100%. There may be some outbreaks where you just cannot identify what happened, what led to the outbreak. But we think it can probably be higher than 50% if health departments have the resources to do what they need to do to be able to identify outbreak contributing factors. So that's one of our goals. Let's increase the percent of contributing factor data that's reported to CDC and used at the state and local level. Another thing that we think environmental assessments can help us identify is environmental antecedents, which is just such a jargony term. A lot of people prefer to say root causes. So this is why the contributing factor occurred. And we've kind of roughly grouped environmental antecedents into 5 categories. So people, processes, equipment, economics, and food. So the categories I don't think matter so much as trying to identify why the contributing factor happened. Was it that people were inadequately trained? Was it that the process was not adequate? Was it that the equipment failed? Again, this is information that we think is really valuable to helping us understand why and how outbreaks occur. So I'm just going to run through an example. This is a real life example from Minnesota. An outbreak was identified, 36 cases of salmonella associated with one restaurant, Restaurant A. The epidemiology and lab work identified, of course, they identified the pathogen salmonella. And they also, it looked like the dinner rolls were the implicated food item. And this information was gathered through epidemiological activities such as interviewing ill workers, those kinds of things. Okay, so based on these data that they got from the lab and the epi, environmental health went out to the restaurant to try to do their environmental assessment to try to understand what happened. So they interviewed workers, they watched food being prepared, they took temperatures, they did a variety of activities in the restaurant. And what they learned was that the process for cooking raw chicken was to brush it with butter before they cooked it. They also had a separate process where they brushed butter on already cooked rolls. They were supposed to wash the brushes in between these 2 activities. They did not have 2 separate sets of brushes. Their brushes were supposed to be washed anytime they were used to brush butter on raw chicken. Well, the environmental assessment activities, the interviews and the observations really led the environmental health specialist to conclude that washing wasn't happening. And they did indeed find the pathogen in the butter that the brushes were stored in. So what that tells you is, it tells us a lot. Let me go. So it tells us that the contributing factor was that butter was brushed on the cooked rolls. The butter was contaminated with the salmonella pathogen. That was not, the rolls were already cooked, so there was no next step to kill that pathogen, right? There was clearly a breakdown in process. There was possibly also a lack of training. that led to this situation, and possibly lack of equipment. They could have had 2 sets of brushes. So when we talk about it in a language that I've been using, there was an outbreak. They identified 36 cases of salmonella. The food vehicle was bread rolls. The contributing factor was cross-contamination. Worker used a brush on raw chicken and bread rolls. So it was cross-contamination from the chicken to the rolls. Okay, that's really important to know. At least in this outbreak, we can use that information to work with the restaurant to ensure that they change that process so it doesn't happen again. Then we can also think about the environmental antecedents. Why did this happen? Well, as I mentioned, there were probably a couple of things going on there. There was a process. The workers did not follow the process to wash the brushes in between uses. And then there was only one set of equipment. There was one set of brushes that was used for ready-to-eat food and for raw chicken. Okay, so in this instance, the data that was learned from the environmental assessment in the restaurant was really helpful in that moment, and then it helped them understand how the outbreak happened, why it happened, and then they sat down with the restaurant and implemented controls. They talked to the management about changing the process, getting new brushes, and then they also did training with all the workers to explain why that process was risky. So in that moment, they stopped the outbreak from happening, and hopefully they prevented an outbreak being associated with that restaurant again for that same reason. So helpful in the moment for that health department. Also, what we want to do is we think if we can collect all these data from outbreak investigations occurring all over the country, and we can aggregate those data, we can really learn a lot to inform national policy, national training. So we can use the data that health departments report to us to really identify sort of the priority areas where processes need to be improved, so we can really influence training and policy. So this is sort of my push for why you would report your environmental assessment data to CDC. Of course, we think everyone should be doing these environmental assessments for their own purposes, to improve food safety in their own jurisdiction. It is another step to then have to report that data to CDC. So I'm trying to make the case here that in the long run is going to be helpful for food safety prevention going forward. That's why 10 years ago, CDC launched the National Environmental Assessment Reporting System. And that's what you guys are here to learn about today. Essentially, we have developed data collection tools that state and local health department staff can take out into the field when they're investigating outbreaks to collect data. Now, you might collect some data for your environmental assessment that doesn't get reported back to CDC. That's absolutely fine, but we are asking that if you are participating in NEHRs, you do report some of that data back to us, and that's what's in the forms. This is designed to be a companion surveillance system at CDC that collects the epi data and the laboratory data so that we can merge those data here at CDC. It can also be a place where you store all your outbreak investigation data. Once you put it into the system, you can pull it back out for your state. It can be a place for you to store your data and pull your data back out. We currently have about 45 state and health departments that are registered to participate in NEHRs. Okay, so obviously I think it sounds like environmental assessments is not something you can just walk off the street and start doing, right? It does take skills, it does take experience, and we're aware of that, and we are aware that health departments don't often have the resources to be able to provide extensive training to their food safety program people. So about 10 years ago, we also launched the Environmental Assessment Training Series, which is an online training. It's web-based. It is free, it's interactive, and it's self-paced. So when I say interactive, you can go in and you can see this interviewer, this worker on the screen. You can actually interview this worker, choose which questions you want to ask him, and then you get the answers. You can also choose a variety of activities in a restaurant kitchen. You can take temperatures, you can look at record logs. So it is really interactive, and it's probably the closest thing you can get to actually like doing a real investigation training. And you can get CEUs for taking this training. And our data show that it is effective. Participants show a 25 percentage point increase in test scores. So you get assessed at the beginning on your basic knowledge about environmental assessments, and then you get assessed on the end. Now this training it's fairly comprehensive, so it probably takes between 6 to 8 hours to do, but it is self-paced. You can start it and stop it and go back. So this is one of the things that we are asking you to do while you're learning about NEHRs and about environmental assessments is, if you don't do anything else for this program, we want you to take this environmental assessment training series. It's not quite the same as being out in the field with somebody else walking you through things, but it is comprehensive, it is fairly informative, and our users report, really good things about it. Okay, so now I'm just going to spend a little bit of time just presenting some basic data that we collect in NEHRs, just to give you kind of a sense of what you might be reporting and what you might be getting back from CDC in your annual report. So one of the main things we report, we collect data on, and these data are from 2021, I think, and it's like for all the outbreaks that reported to NEHRs in that year. Most of the outbreaks reported to NEHRs are norovirus outbreaks. So you'll see some basic data about outbreaks themselves in the system. You'll see contributing factors to the outbreak. So when they're identified, we look at the data, and you'll see that one of the primary ones is bare hand contact by an infectious food handler, which makes sense as most of the outbreaks reported to us are norovirus. This is also data that you'll get in an individual report for your site. So at the end of the year, you can look and say, oh, it does look like we're having this particular problem. Perhaps we can target it in this next year. We also collect some data on outbreak establishments themselves. So whether or not they're independently owned, whether or not they have complex food preparation or simple food preparation, and then how many meals they serve per daily. And again, this is just sort of an example of the kinds of data that we collect in NEHRs. We also collect some data on the policies that exist in the restaurants. So for example, we ask if they have policies to restrict or exclude ill workers. There are some data to suggest that these policies can help prevent norovirus outbreaks. So it's really important to understand if the establishments have these policies. So you'll see that 47% of the restaurants we interviewed said that they had a written policy, 39% said they had a non-written policy, and 14% said they had no policy. And then on the right, you'll see data on if there's a policy where workers need to tell their managers when they're ill, so the managers can make decisions about whether or not they should work. And then we also collect a little bit of data on the investigations themselves. We're finding that this data is really helpful in understanding how investigations are being conducted and where the gaps are in investigation practices. So on the left, you'll see here we ask, like, how many visits does it take you when you go to a restaurant to really collect all the data you need for your environmental assessment? And you'll see about half of them are done in one visit, and then a quarter in two, and then a quarter in more than two. And then we also ask them, how soon can you get into a restaurant to begin your environmental assessment once you learn about the potential outbreak? And you can see that the large majority of them say that they make it there within the same day. 23% within 1 to 2 days, and then this 8%, it takes them 3 or more days to get in there. And so this is an example of the kinds of gaps that we might be able to identify with these data reported to NEHRs. Okay, just a couple of short-term benefits of NEHRs participation. This is where I do the rah for participating in NEHRs. As I said, we do provide you with an annual report every year summarizing NEHRs data. It gives you sort of a really good snapshot of the outbreaks that you investigated in the previous year. And this, if you are trying to meet FDA standard 5, it does help you meet that standard. You can collaborate and communicate with other sites that participate in NEHRs. We have quarterly meetings. We occasionally have in-person trainings. There are scientific publication opportunities. We really appreciate it when we have actual site people helping us analyze and interpret the data that we collect from NEHRs. And then, as I said, it does help you document and track your foodborne outbreak response data. So you can take a look at, some of the response activities. How long does it take you to get in there? How much time are you spending on these activities? And that can help you in a variety of ways in terms of evaluation of your program. Here's an example annual report. This is from 2015, but you can kind of get a sense of the data that we report. You'll see the contributing factors, your most common contributing factors for that year, the average number of visits it took your staff to complete environmental assessments. So that just gives you a sense of what these reports look like. And then we have some long-term benefits of NEHA's participation. We firmly believe that the data we get are going to help us improve foodborne outbreak response. We've gotten enough outbreaks in the system now that we've started to analyze data. And here's just an example of one of the things we've learned from the data. That we've learned that health departments, investigators can identify outbreak contributing factors much more frequently when a pathogen has been identified and when environmental assessments were comprehensive and timely. So one, this really highlights the importance of EPI and environmental health working together, sort of a comprehensive approach to outbreak investigation. And it highlights the importance of the environmental assessment. If you get in there and do a good environmental assessment, you're much more likely to figure out what caused the outbreak, what happened. And again, if you know that, you can work to stop the future one from occurring, a future one from occurring. We also firmly believe that data from years are going to help us in the long run improve retail food safety. And I'm just, again, I'm going to give you an example of some data. We found that norovirus outbreaks were significantly smaller when restaurants had enacted certain policies and practices. So again, our data set is all outbreaks, right? So we looked at all the norovirus outbreaks reported to NEHA. Some of them were small, some of them were large. We found the outbreaks were more likely to be mitigated, were more likely to be smaller, have fewer sick people when their managers were food safety certified, and the managers and workers had received food safety training, when the food workers wore gloves, and when the restaurants had cleaning policies. So I'm just going to show you a slide of data. So you'll see restaurants that provided no training, really no food safety training at all to their food workers. Their average outbreak size was 25 sick people. If you look at on-the-job training, the outbreak size goes down a little bit to 22 ill people. Then you go down to only classroom training and you see 20 ill people. But then when you get to restaurants that provided both on-the-job training and classroom training, you see a pretty dramatic drop in the number of sick people. You see drops to 11. So we go from 25 to 11, which is a significant decrease in the size of outbreaks. So this isn't talking about preventing outbreaks, right? Because these are all restaurants that have had outbreaks. But it does really suggest that training, and then the other things that we won't talk about today, but training and certification and really good food safety policies can prevent more illnesses. It can protect people. It can keep the outbreak smaller than if you did not use those policies and practices, which is huge. This really shows the value of restaurants engaging in these activities. And in the long run, we think it's these kinds of data that are going to really move restaurants to food safety. All right, that was a lot of information. I'm going to just do a quick recap. We in the Division of Environmental Science and Practice really support the collection and analysis of environmental assessment data. We think it's important for health departments to do, and we would love to see those data reported to CDC. We think in the long run that will help us improve the identification of outbreak contributing factors and outbreak environmental antecedents. Those data will help us improve prevention and intervention going forward, which will improve food safety and lead to fewer outbreaks. So that's sort of the big picture of why we launched NEHRS and why we're working with you to help you learn more about NEHRS to see if it's a good fit for you. So I think I will stop there and turn it back over to Nichol.
Great. Thank you, Dr. Brown. So we have a couple NEHRS users here today that are going to speak to you of their experiences using NEHRS. First, we have Kayla Anderson from Ottawa County Department of Public Health. Kayla, you could go ahead and share your screen.
Good afternoon, everyone. Just one moment while I get my screen pulled up here for you. All right, can
Looks
everyone see
good.
my screen? All right, great.
Yes, thank you.
You're welcome. All right, everyone. So thank you so much for being here this afternoon. My name is Kayla Anderson. I'm a senior environmental health specialist and serve as the lead foodborne illness investigator at the Ottawa County Department of Public Health. And today I have the pleasure of sharing how implementing NEHA has improved our foodborne illness outbreak response in Ottawa County. To provide a brief overview, our department is located in Ottawa County, Michigan, where there's a population of more than 300,000 people. The map on the right highlights that Ottawa is the fastest growing county in the state, which is great motivation for us to utilize NEHA. Ottawa County is located on the west side of the state and borders Lake Michigan, which makes it a very popular tourist destination. And during the summer months in particular, the risk for foodborne illness outbreaks increases significantly due to the high amount of community events and festivals that are held. Specifically, the Coast Guard Festival and Tulip Time Festival are the largest held in the state. And with the Coast Guard Festival, we see about 300,000 attendees, which is the same as Ottawa's population. And the Tulip Time Festival draws approximately 600,000 attendees. So the risk for foodborne illness goes up significantly during those times. A little bit about our department. We are located in Holland, Michigan. We have 7 environmental health specialists who are responsible for overseeing more than 800 food service establishments and approximately 1,300 total facilities, which includes body art, food trucks, and licensed food service establishments. When an outbreak occurs in Ottawa County, we utilize NEHA, which helps us investigate with clear intention and has led to our progression in foodborne illness response. So what is that clear intention? That is to identify the root cause of an outbreak, to intervene and prevent it from occurring in the future. Before we implemented NEHA, Ottawa County did not have a standardized system to help guide our foodborne illness outbreak response. We know that each outbreak is unique, but when investigating outbreaks, the same challenges seem to persist. 2 of these challenges included juggling multiple elements of an outbreak, and report writing was slower with less detail regarding the root cause of the outbreak. After implementing NEHA, it helped our department advance our outbreak response. So the NEHA system utilizes forms to gather information during outbreaks, as Dr. Brown was showing us, and these forms have provided structure that helps us ask the right questions at the right time. As you collect the data required for each form, the whole picture of the outbreak becomes clear, which allows you to provide more effective recommendations for facilities. It helps one relate to the establishment situation, which improves the overall communication and relationship with those involved. The forms are also a great reference when compiling the final narrative report, and it covers all necessary elements and serves as a really quick reference for you. When comparing what is required by the state of Michigan to meet the minimum program requirements 15 and 16 for foodborne illness complaints, we see that implementing NEHA only has 2 differences, and these are highlighted in yellow on the right, which would be the forms, part 1 through 7, and then entering the data into the NEHA online database, which is a very straightforward process once you learn the ins and outs of it. And NEHA has increased our ability to meet our required minimum program requirements and our internal policies. To give you an inside look at what NEHA looks like in action, we are going to walk through a quick case study of an outbreak that occurred in 2019 in Ottawa County. August 8th, 2019, our department was contacted by a community member. They notified us that 3 out of 4 individuals became ill with gastrointestinal illness after eating at a food service establishment in Holland, Michigan. Outbreak response was triggered. So what is our next step? Grab our NEHA toolkit. Let's go. All right, so inside our NEHA toolkit, there are 7 parts, and that includes general characterization of the outbreak and the outbreak response, establishment characterization and menu review, manager interview, establishment observation, suspected and confirmed foods, suspected and confirmed food ingredients, positive samples, and lastly, contributing factors. So those are the 7 parts that we are going to walk through. Part 1. So on your right, you will see an example of what the form looks like. Part 1 helps us characterize the outbreak comprehensively. Specifically, the section characterizes the scope of the outbreak, number of environmental assessments conducted during the response, the suspected or confirmed agent if known. It also determines potential contributing factors and environmental antecedents, assesses overall communication, and helps connect environmental assessment data to EPI data. Part 2 is completed simultaneously with Part 1. Part 2 focuses on gathering basic information about the establishment, what food is offered, and potential language barriers. By completing parts 1 and 2 of the NEHA forms, we were able to identify that 3 out of 4 were ill with GI illness from 2 separate households. Ottawa County's CD team, communicable disease team, completed interviews with the complainants. Common restaurant and food type were identified, and it was classified as a suspect outbreak. Moving into part 3, which is the manager interview, this helps us characterize policies and practices occurring at the establishment. Several interviews may be completed with different managers, and this form should reflect the interview with the manager that has the most authority over the food service operation and is most familiar with day-to-day activities that occur in the kitchen. It is best if this form is completed no longer than 48 hours after the outbreak was identified. After completing the manager interview for this investigation, 4 primary environmental antecedents were identified. It was evident that food service workers were lacking knowledge about the establishment's illness policies and had not been trained in basic food safety. They were not overseen by a certified manager, and there was simply not enough staff members to maintain a safe food service operation. What I love about the manager interview is that purpose lies behind every question, and it helped us pinpoint why something went wrong. The establishment observation helps assess practices seen during the environmental assessment. So be sure to complete this part early on in the investigation and while the establishment is open for service. The goal is to capture existing circumstances and practices. Our overarching goal is to determine how something went wrong, which is called contributing factors. These factors are categorized as contamination, proliferation, and survival of microorganisms or toxins. Part 5 from our toolkit helps an inspector gather and organize the necessary environmental health, EPI, and lab data. During this particular investigation, we scheduled a time to observe preparation of pico and salsa. Several violations were cited, which highlighted areas in need of improvement while demonstrating that we were truly there to help them. Out of the 3 types of contributing factors, we identified that contamination and survival were applicable. 1 food worker worked while ill and did not report symptoms to their employer. The main hand washing sink was blocked upon each arrival, which was disappointing. Improper storage of utensils in pico and salsa were cited. And lastly, our survival factor, which was ready-to-eat foods with no kill step. Part 5 is only completed if a food item is identified as a suspect or confirmed source. We found that a systematic review of food preparation processes of the suspect food was necessary to identify contributing factors. Mapping out the food flow from receiving to service helped us identify critical control points where contamination and survival occurred. Part 5B takes it one step further, and it boils down to specific ingredients, which are categorized by type of food, describes the state of food, and the description of the food upon arrival to the establishment. In this situation, all suspect ingredients in our outbreak were vegetables that arrived to the establishment in a raw state. These are the two ready-to-eat foods, pico and salsa. And as you can see, handles are in contact with both food items, making bare hand contact quite plausible. Part 6 only applies in some situations. Questions in this section help characterize samples. Were there agents found in the samples? Where was the sample taken from? No environmental samples were collected during our investigation, only clinical. So what agent do you suspect that we found? Dr. Brown mentioned that this was one of the most common that was reported, and that is norovirus. After analyzing the data, we concluded that ready-to-eat food items were a plausible vehicle for transmission of norovirus. How contamination and survival of the pathogen occurred and why. Importance of connecting with food service workers during the investigation and providing a trusting environment. Does anyone know why the arrow is pointing to the left instead of the right on the bottom? It's because we work backwards to understand why an outbreak happened, and NEHA helps us do that. To help address the root cause of the outbreak that we investigated and to ensure long-term compliance, we provided 6 recommendations for the facility. A certified manager on site to oversee the operation, providing adequate training to all employees, which specifically includes improving hand washing and glove use practices, preventing bare hand contact by implementing utensils with handles, developing an illness policy and SOPs, and reviewing them both with the employees to make sure they are understood. We have officially walked through what an environmental assessment looks like using NEHA, and we now see the positive outcomes that can come from it. So thank you all for attending, and remember that together, everyone achieves more. So thank you for your interest in NEHA, and feel free to reach out with any questions.
Great. Thank you so much, Kayla, for your presentation. That was great. And now we will move to Nichol Smith from the Massachusetts Department of Public Health.
Thank you. Yes, my name is Nichol Smith. I am the Outbreak and Response Coordinator for the Food Protection Program in the Massachusetts Department of Public Health Bureau of Climate and Environmental Health. Our name just recently changed. So I don't have any slides today, but I am going to share my screen, and I'm just giving everybody a warning that I will be scrolling through some pages. So if scrolling through pages might make you dizzy at all, just feel free to listen to me. And if you want any of the documents that I share, feel free to email me and ask me for those. So let me share my screen real quick. So I am going to be sharing some tools that we use here in Massachusetts, but I want to start with this map of Massachusetts I just found quickly on our mass.gov website. So in Massachusetts, we have 351 cities and towns. We are a decentralized state, so that means that each local jurisdiction has jurisdiction over their retail establishments. So 351 cities and towns. We don't have county health departments. It really is all of these cities and towns. So anytime that we have an outbreak, it's likely going to be a different health department that we're working with every time. We have had some, maybe every other year we might see a larger jurisdiction pop up, but these smaller communities, they might work on an outbreak once every 30 years. We just had an outbreak recently where the health director said, the last time I had a salmonella outbreak or an outbreak at all was 1991. So the folks that we work with, they might not necessarily have all the tools ready to go to do an outbreak investigation, which is where NEHA can help out a little bit. So let me go over to our next thing. So as Kayla just shared, the NEHA assessment, the NEHA instrument with all the questions and the 7 different categories of questions, I've adapted this document to be specific to our local boards of health. So instead of having all of these sections, the local boards of health only need to complete 4 of the sections out in the field. So they complete parts 2 through 5. And we can go over to my other screen here. So let me scroll back up here. So this is our instrument. I've labeled, this is really small. So this is our instrument here. This is the cover page. So in 2017, we did inform local boards of health that we would be asking for these questions. So down here at the bottom, it says that their role is to complete the form only during an outbreak. So that is also an area of miscommunication for our folks where they might have an outbreak and then moving forward, anytime that they get a single foodborne illness complaint, they think that they need to complete NEHA, but just during an outbreak. So I have it labeled as 1 through 4, just so our local boards of health don't get confused that they get a form and it's starting on part 2 and they go, hey, wait a minute, what's going on here? Where is the first part? So I'm going to scroll a little bit here. So again, it is the same exact questions that are on parts 2 through 5, but I've just relabeled them so our folks don't get confused. And it is the exact same form, just in a little bit smaller format. So it's a little bit easier to digest for them. And then I've also incorporated some buttons in here so they can clear any of the portion here. They can save it. They can print it right off. And then at the bottom, there is a portion that they can click to email and it'll email it right to me. And then let me go over to our fake Maven disease surveillance system. So in here, this is our foodborne illness complaint module. So when we have an outbreak, our question package 4 here, single incident would be a no because it would be an outbreak. This is where we track our contributing factors. So I always click other and I will write the exact contributing factors like C4 and then the definition of whatever the contributing factor was. So this allows my EPI partners who fill out the NORS portion, they will be able to put in these same exact contributing factors and we don't have to go back and forth to figure it out. It's right here for both of us to review. And then at the bottom here, NEHA was completed? Yes. So I can always run reports and go through which events and outbreaks we were able to complete a NEHA assessment for. So this helps me because me and my team are the ones who fill out the electronic portion of NEHA. We don't have many jurisdictions who are enrolled to complete the information in the database only because they might not see an outbreak for years. So we have, I believe, 2 jurisdictions currently enrolled to enter their own data, but I'm actually not sure if they have had opportunities to do that as of yet. So this helps me make sure that everything that we did collect in NEHA form 4, I can go into the database and enter those. And parts 1 and 6 and 7 are the parts that we complete ourselves at the health department. Because that is information that we're collecting throughout the outbreak and we don't necessarily need folks on the ground to collect that information. So that would be the contributing factors. And I believe, I can't quite remember what the first part is, but that's information that we're collecting throughout the outbreak. I believe that was everything that I wanted to share. But that is how we utilize it in Massachusetts. As a quick summary, we're very decentralized. So our boots on the ground folks, they get this short, semi-short form. They can go out and use that form to collect that information. I think I also had a job aid. That was the last thing I wanted to mention. We did create a job aid because, again, these folks aren't seeing this form very often, and it'll help them understand what is NEHRS, benefits of participating in NEHRS, our expectations, what the form is, because again, they've probably never seen it before. The electronic portion, if they want to enroll themselves into the program, and then the components. I'm going to scroll a little bit further here. Common errors when completing the form. So I know folks at CDC don't like when we put in errors in there, so we try to get the data completed as possible before we enter it. So to help them, if there's a kitchen manager, they put there's one kitchen manager, and then they later put that there are 3 that were trained, there's that discrepancy there. And then our last portion is just the take-home message that I'm not even sure if they get to this far in the job aid, but we do provide it to them, and they have their resources there. So that is everything that I have. Thank you so much.
Hey, thank you, Nicole, for sharing all that and sharing what best practices that you've implemented. That's great.
Thank you.
Yes, of course. So to the audience, all of our attendees today, we will open up Q&A for anyone that may have any questions for any of the presenters today. You could utilize the Q&A box, if you would, to drop in any questions.
We have just a quick comment, Nicole.
Sure.
So for some of you, we know there's a lot of variability in sort of outbreak investigation practices and experience across the country. And if there are some of you that don't have sort of the developed processes that you heard about today, we totally get that. And we would know, when we're working with NEHRS sites, we try to kind of meet them where they are. And so don't be intimidated, I guess is what I'm saying, because we can help you start from wherever you are with implementing NEHRS. And we do have some very experienced sites that are also willing to ask questions and help you along the way.
Thank you, Dr. Brown. Any question? If it's easier for you to use the chat function, please go ahead. I have both open and I'm watching both. Or any other tips from Kayla or Nicole?
It's a note of encouragement.
Go ahead.
Oh, yep. I just wanted to encourage you all that we are here to help answer any questions. We can give you a little demo of what outbreaks we've been working on, whatever you need. We're here. So I encourage you to keep pursuing it, and thank you so much for your interest.
Thank you, Kayla. So it looks like Kevin Smith wanted to make sure that they're using the right tool. Is the interview tool available online, or will anyone be able to share that with us?
Yeah, we'll send a document out or a link out. We don't actually have the tools on the CDC website, but we do have an online community, and we can also just send you, the document as well. So we'll do that in the next week or two.
Great.
I'll just add a comment. I see Justin put in the chat, the presenters made it look real simple. It is. It's very simple. You'll have no problems with it, I promise.
Thank you. Feel free to drop any questions. And I'll just provide a reminder to all attendees. You will receive a link to the evaluation for being here today for the webinar, which is also one of your deliverables for the program. Just a note segment for all of you. Thank you. I don't see any more questions coming in at the moment, but just if you think of a question later, please reach out. You could reach out to CDC directly through the email, or you could send it to me and I could forward that along to Dr. Brown. Yeah, I don't see any more questions.
Well, thank you all for attending today. And thanks,
All right.
Kayla and Nicole, for presenting.
Yes, thank you both very much. Great. Everyone have a great day.